Bone cancer is a disease that occurs on or inside a bone. Usually, bone cancer involves a tumor filled with abnormal cells that will occasionally appear on the exterior of the bone. Similar to other types of cancer, bone cancer can be life-threatening. There are 5 different types of bone cancer that can affect people from ages 10 to 60. Bone cancer can occur in any bone in the body from legs to the head. When recognizing symptoms at an early stage, doctor can complete testing and supply treatment to the patient. There are 206 bones in the body. Each bone serves different purposes. The bones of the body act as the structure that helps to support and protect many internal organs. According to the Medicine Net online, healthy cells grow, divide, and multiply throughout the body. Cells make up the body tissue. However, some cells can become abnormal. It's a given that healthy cells make up body tissue. Unhealthy cells grow and destroy body tissue and can often spread to other body parts. Abnormal growth of cells is called cancer. According to the survey by the National Institute of Health and Public Service, only about 2,000 new cases of bone cancer in the United States are diagnosed each year. The survey showed that males are more likely than females to develop bone cancer, and bone tumors are more likely among children and adolescents than among adults. The types of bone cancer. 5 types of bone cancers made by the National Cancer Institute. The most common type of bone cancer is osteosarcoma, which commonly affects people from the ages 10 to 25 years old. Osteosarcoma develops in new tissue, usually in the legs and the arms or around the knee joint. Chondrosarcoma is another type of bone cancer. It usually develops in the cartilage of the pelvis, upper part of the legs and arms, and the shoulder. Ewing sarcoma is a bone cancer that is known to begin in immature nerve tissue in the bone marrow. It attacks the pelvis, the femur, and the tibia. Ewing sarcoma usually affects people from 20 to 30 years old. The last type of bone cancer is malignant fibrosis. Both of these types of bone cancer are very rare and usually develop in the arms and legs and around the knee joint. Malignant fibrosis and fibrosarcoma are known to affect middle-aged people. The symptoms of bone cancer. Bone cancer can sometimes be hard to detect. Symptoms of bone cancer can develop very slowly, if at all. But Medicine Net online states that most common symptoms of bone cancer is pain. Often one will develop swelling and tenderness in the affected area. Sometimes slightly visible lump may be felt through the skin. Bone cancer can also interfere with body movements like walking or hiking. Broken bones can also be a result of bone cancer. According to the summary of tests and procedure by Medicine Net Online, doctors will order blood tests and x-rays. The exact size, shape, and location of the bone tumor can be seen through x-ray. Then a CAT scan will be completed to show whether the cancer has begun to spread to other parts of the body. A CAT scan will give detailed pictures of the magnetic resonance imaging. But a biopsy is the ultimate test that will make sure that cancer is present in the body. Bone cancer treatment. There are 3 types of treatment for bone cancer: surgery, chemotherapy, and radiotherapy. The treatment Preference depends upon the type, location size, and the extent of the tumor along with the patient's need. Sometimes a combination of 3 treatments is used on a patient. Because cancer can reoccur in the original affected area, surgeons often remove the tumor tissue and some healthy bones surrounding the tumor. In some cases, especially in children, a metal device will be implanted in place of the bone that was removed by a surgeon. Another type of treatment is chemotherapy. The National Cancer Institute, which covers both chemotherapy and radiotherapy, states that chemotherapy uses several drugs that kill cancer cells. Chemotherapy is very intense treatment that can be given by mouth or by injection into a muscle or a blood vessel. Chemotherapy is so powerful that there has to be a treatment period followed by a recovery period. The last treatment for bone cancer is radiotherapy. This type of treatment uses high energy rays to damage cancer cells and stop them from growing. Radiotherapy can sometimes be used in place of surgery to remove the bone cancer. Another use for radiotherapy is to kill cancer cells remaining in the affected area after treatment. According to research taken in 2003 by the American Cancer Society, 2,400 new cases of bone cancer will be diagnosed this year, and about 1,300 deaths from these cancers are expected. During the study, 35% of all bone cancer cases was osteosarcoma, 26 was chondrosarcoma, 16 was Ewing sarcoma, 8% was chordoma, and 6% was malignant fibrosis. In conclusion, the 5 bone cancers are very small proportion of the 100 or more cancers known to man. However, the National Cancer Institute is developing and sponsoring clinical trials on bone cancer patients in many hospitals and cancer centers. The National Cancer Institute is trying to find effective treatments and methods for bone cancer. Thank you.